Hey everyone, and welcome to This Explainer. Today we're going to dive way past the viral internet trends and those endless TikTok comment sections. We really need to get to the clinical truth about narcissism. More importantly, we're going to explore our main focus for today, how these social labels actively impact real patients. Who is actually getting hurt by our cultural obsession with this word? Well, stick around because it matters to absolutely everyone who cares about mental health.
I mean, you've probably seen it, right? Shocking headlines, clickbaity YouTube thumbnails, or social media posts offering literal guides on how to torture a narcissist. It's kind of wild. It is almost impossible to browse the internet right now without seeing a complex psychiatric condition being treated like a comic book villain. People are actively seeking out advice on how to inflict pain on others, and the craziest part, they're doing it all under the guise of self-help.
And to put this cultural fixation into perspective, the numbers are literally staggering. According to search data, interest in terms like gaslighting spiked a massive 1,740% in 2022. I mean, it literally became the word of the year. At the exact same time, searches for narcissism jumped over 150%. So we are collectively obsessed with these terms. But the real question is, are we actually using them correctly?
To really unpack this, here is our roadmap for the explainer. We'll start with the rise of therapy speak, then move into the reality of narcissistic pathology, followed by how stigma harms patients, the clinician bias problem, and finally, reclaiming nuance and empathy.
All right, let's jump right into section 1, the rise of therapy speak.
So we've fallen into this really modern trap. We think we're out here raising mental health awareness by using all these clinical words, but a lot of the time, we're actually just weaponizing psychological jargon. Social media is acting like this giant echo chamber, taking incredibly complex, nuanced human behaviors and flattening them down into viral one-liners. We end up pathologizing totally normal relationship conflicts just to win arguments, or honestly, to avoid accountability when we're dealing with people who just frustrate us. Here's the real kicker, though. Phrases like narcissistic abuse, they aren't actually rooted in peer-reviewed science. Seriously, they do not exist in the official diagnostic manuals. It's an entirely pop psychology invention. It reflects this cultural urge we have to take ordinary relational distress or, just standard bad behavior and escalate it into a severe medical diagnosis. Basically, we do it to make ourselves feel better or to make the other person look like the absolute bad guy.
Which brings us to section 2, the reality of narcissistic pathology.
When you actually compare the internet's definition to the clinical reality, there is a massive, massive disconnect. The internet paints this picture of a malicious mastermind, someone consciously manipulative, trying to destroy you like a cartoon villain. But clinical reality, it shows us something entirely different. It reveals a person struggling with profound inner fragility, intense aloneness, and paralyzing fear. It is fundamentally a disorder of dysregulated self-esteem rooted in deep trauma. It is definitely not a supervillain origin story. You'd think the condition was everywhere based on how much the term is thrown around online, usually directed at anyone who just acts selfishly. But narcissistic personality disorder, or NPD, is actually a really severe low-frequency pathology. Research estimates it affects only about 1 to 2% of the general population. So no, it's not everywhere, and it's certainly not everyone who breaks your heart or cuts you off in traffic. So clinically speaking, NPD is characterized by grandiosity and a need for admiration, but it is fundamentally driven by dysfunctional self-esteem regulation and severe underlying shame. Once you grasp this definition, your whole perspective kind of shifts. That arrogant exterior that society just loves to hate, it's actually a desperate defense mechanism. It's a psychological shield trying to mask deep developmental trauma and a complete inability to tolerate shame.
Okay, section 3, how stigma harms patients. This is the absolute core of our explainer today. We need to unpack the real-world, devastating ripple effect these societal labels have on actual patients. Have you guys ever heard the term testimonial injustice? It is a really heavy concept. It happens when someone diagnosed with NPD is instantly culturally caricatured as a habitual liar. Just because they carry that specific psychiatric label, their genuine suffering or even legitimate claims that they are being abused themselves are completely dismissed without a shred of evidence. They are quite literally stripped of their credibility just for having a mental health diagnosis. Weaponizing this buzzword, it literally destroys lives. It doesn't bring justice. It just builds these massive walls that alienate a highly vulnerable population from getting the therapy they desperately need. It ramps up their internal shame. Patients are terrified to seek help or even tell their families because they're afraid of being treated like monsters. We're talking devastating reputational damage in workplaces, and it even unfairly sways legal disputes and custody battles.
Labeled, criticized, looked down on. That quote comes straight out of clinical research from Harvard psychologists, and it perfectly sums up the lived internal experience of someone carrying an NPD label today. They don't walk around feeling like evil masterminds. They feel alienated, profoundly shamed, and completely unsupported by the society around them. Moving right along to Section 4, the clinician bias problem.
Now, therapists are human too, right? And there's this psychological concept known as countertransference, which is basically when a therapist's own biased emotional reactions end up totally derailing a patient's treatment. If a patient comes in acting grandiose, a therapist who is absolutely influenced by all that societal stigma might react with anger, hostility, or avoidance. On the flip side, if the patient seems vulnerable, the therapist might feel sympathy but end up totally misdiagnosing them. So the stigma is quite literally preventing doctors from doing their jobs effectively.
Let's trace exactly how this system fails, step by step. First, the public normalizes and overuses the label. Then, clinicians internalize that stigma, leading to that negative countertransference we just talked about. From there, we get diagnostic inflation. Doctors start seeing NPD everywhere, completely misidentifying other trauma conditions like CPTSD or borderline personality disorder. The result? Real patients suffer because they end up getting completely erroneous, ineffective treatment.
And finally, Section 5, reclaiming nuance and empathy. I want you to pause and ask yourself this, and try to reflect honestly for a second. When you call your ex or maybe a tough coworker a narcissist, are you actually trying to understand their clinical psychological profile? Or is it maybe just a really convenient way to protect yourself from the ambiguity of a messy relationship? A relationship where, just maybe, both sides made some mistakes. It's a tough pill to swallow, but it's so much easier to write someone off as a toxic monster than it is to sit down and do the hard, messy work of authentic communication and self-reflection. When we throw around labels, we kind of let ourselves off the hook. We pathologize normal conflict because we're uncomfortable with human imperfection, using therapy speak as a shield against our own systemic flaws.
As we wrap up this explainer, I want to leave you with this final thought. Labels carry weight, massive weight. And as we've seen, the words we use have profound, real-world consequences on vulnerable people and their medical care. So going forward, will you continue to use therapy speak as a weapon just to avoid discomfort? Or will you choose the much harder but infinitely more rewarding path of holding on to clinical nuance and genuine human empathy? It's a choice we all have to make. Thanks so much for joining me today, and keep asking the hard questions.